Quality standards for TB control. So what is TB infection? It is a very high priority to prevent the transmission of TB tuberculosis between patients and to health workers. TB, it is an droplet transmitted information. Droplets from the cough or sneezes of by an infected patient person will transfer to a susceptible host. Okay, and that's how Mycobacterium tuberculosis will attack the susceptible host, and tuberculosis is spread. So TB control, WHO has integrated the following steps in TB infection and prevention control. So the first step here is triage of the people with TB signs and symptoms or with TB disease. As soon as you come across a patient who have chronic cough since months and have, along with that, they have excessive weight loss. Okay, they screen them and separate them, isolate them from other patients, and screen them, do the smear positive test, sputum test, etc. So that is triaging the people, separating them from other patients who have the TB signs and symptoms or who are diagnosed to be tuberculosis positive. And next, respiratory separation. Make sure that they are using masks, they are using cough etiquettes, etc. And isolating them from general patient areas. So that is a respiratory separation. Prompt initiation of effective TB treatment of the people with TB disease, like DOTS therapy, isoniazid therapy, etc. Respiratory hygiene, health education on respiratory hygiene, cough etiquette, etc. should be provided by the health workers. Upper room germicidal ultraviolet system should be attached in the rooms where examination and screening of TB patients are done. It means that some HEPA filters and some ventilation systems, they come along with ultraviolet radiation, and there are some lighting facilities which will send ultraviolet radiation, and that will kill the microbes in the droplets which are near the cuffs and diseases of the patient, thus making sure that droplets are being taken care of, and it will not spread from one person to another person in the same room. Ventilation systems, again with ultraviolet radiation, ventilation systems are there, HEPA filter ventilation systems are there, etc. Particulate respiratory, for example, N95 mask is used within the framework of respiratory protection program. N95 mask is recommended for respiratory protection for TB patients. So it has three main areas. The first area is the patient safety, human resources for health, and the person centered. So these are three main areas whom we have to take care of when it comes to infection control. Patient safety, what you have to check is you are reducing the hospital healthcare associated infection, and infection prevention control policies and protocols are followed to safeguard the patients who are undiagnosed or diagnosed or who are at risk of getting TB. In healthcare workers scenario, make sure the occupational safety, health and safety guidelines are being followed. The steps you take in TB control and infection prevention is in line with the OSHA's recommended policies and guidelines. When it comes to person central, address the stigma related to the TB, the social stigma that the TB patients has, and health workers well-being, etc. Make sure the community participates, understands it is treatable, and it doesn't violates, or it doesn't play any bias in terms of the patients who are affected with TB. So these are the three main areas of TB infection control. So 10 essential actions for an effective TB infection control. Safety without stigma is first, include the patients and community in advocacy campaigns. For example, educate the patients and the community about TB. What is TB? How to prevent it? How to control it? What are the DOTS therapies available nearby? Encourage them to be aware of the social themes such as our community is TB safe. Campaigns, our healthcare facilities are stopping TB campaigns. Okay, such encourage them to participate in such awareness campaigns, etc. Second is to adapt an infection control plan. Each healthcare center should have an infection control plan, and the staff and the team should be there should be who is responsible for the infection control plan. They will identify the high risk areas where the most of the TB is being transmitted and provide information about the TB and HIV rates for the healthcare workers and the patients, etc. And area-specific infection control practices are put into place. For example, separate area for the patients suspected with TB, separate entrance for patients suspected with TB, and isolating them from the general patient areas, etc. So next, ensure safe sputum collection. Sputum collection can be potentially hazardous both for healthcare workers and for other patients. So workers need to explain that the patient safety, explain to the patients that safety without stigma is the goal of a good TB infection control, and they need to be stressed that the sputum should be collected outdoors if it is feasible and not indoors. Promote cough etiquette and cough hygiene. Using poster to impart this message will be very helpful. Health centers should have posters on TB infection control and cough etiquette. The patients need to be instructed to cover their mouth when they and nose with hands and clothes such as handkerchief and clean rag tissues, paper masks, etc. while they're coughing and sneezing. So these are the cough etiquettes that has to be taught. Cough and sneeze into your arm, position your arm like that, etc. Triage the TB suspects for fast track separation. So screen all the patients on arrival for cough for chronic cough which is lasting more than 2 to 3 weeks, who has fever, weight loss, night sweats. When they are coughing out blood. Okay, and who had a past history of a contact with a suspected TB case. Okay, you have to triage these patients, you have to separate them. These cases should be fast tracked. Rapid diagnosis and care services should be provided in these cases. Assure rapid diagnosis and training initiation. Patients suspected of having TB should move to the front of the queue for all the services and need prompt evaluation of the TB. So this has to be followed. Specimens should be directly sent to quality assured laboratory for acid fast bacillus test, smear culture test, etc. As AFB smear positive test, etc. Chest X-ray and referral visits, etc. So that is a rapid diagnosis and training initiation. Improve room air ventilation. Like patients' waiting area should be open and well ventilated. It includes leaving the windows and the doors open at all times when possible to maximize the cross ventilation. And the fan should be appropriately placed so that the air from the patients won't reach to the healthcare workers or other patients. So that's how the room ventilation has to be taken care of. Protect the health workers. The health workers should be adequately vaccinated and they should know the signs and symptoms of TB. Health assessment of the health worker should be taken before assigning them the task of TB infection control. All workers are encouraged to know their HIV status, and those with HIV infection should be given an opportunity to minimize the exposure to people with TB. Capacity building. All the health workers should receive in TB infection control training and should be engaged in improving their own and patients' safety and health. Monitor infection control practices. So overseeing the infection control practices should be the part of every supervisor's visit. It should include the facility tour. Check that the infection control strategies is being implemented at all infection control supplies. Is there any shortage of any resources, etc. Yeah, so these things should be supervised, reviewed, documented, and reported to the health authorities. So TB infection control program, you can see the top first priority is the administrative measure. From the administration should be very well invested to comply with the protocols and policies of the TB infection control program. Second, the environmental controls. Do you have a well ventilated examination room to examine the TB patients? Do you have isolation facilities? Do you have barrier techniques being continuously being used in your healthcare facility? Okay, these are the questions that has to be answered for environmental controls. Use of respiratory protective equipment at all case, providing respiratory protective equipment for suspected TB cases and patients who have chronic cough and sneezes. PPE for the healthcare workers and staff, etc. So these are the things that has to be taken care of.